Now we'll check the L2 myotome, that is the iliopsoas muscle, and the hip flexion. So for this movement, we'll tell the patient to lie supine, and then we'll ask the patient to flex his knee at about 15 degrees, to flex his hip at about 15 degrees and his knee to around 90 degrees. So once the patient has made this position, we'll ask the patient to flex his knee and the hip and bring his knee towards his body. If the patient is able to do this movement, that means the patient has grade 3 power. Now we tell the patient that we will be applying some force at this point when the hip and the knee are 90-degree flexed, and if the patient can make the movement against my moderate resistance, that means the patient has grade 4 power. And if he is able to flex the hip against maximum resistance, that means the patient has grade 5 power. Now if the patient doesn't even have grade 3 power, then we will have to eliminate the gravity. So for that position, we tell the patient to externally rotate his leg at the hip joint and to flex his knee at the knee joint, and then we ask the patient to flex his hip joint at this position. And if he is able to do the flexion at this position, that means the patient has grade 2 power. Again, we can demonstrate that. So if he is able to flex, that means the gravity is eliminated in this position and the power is grade 2. But if he is not able to flex at this point as well, then we need to palpate the iliopsoas muscle at the anterior superior iliac spine, while however little movement is there at this joint, or we can passively do hip flexion. If we are able to palpate the contracting muscle and the tendon, that means the power is grade 1. And if there is no movement at all at this joint, that is hip flexion, so that means the power is grade 0. L2 myotome testing is done.